Hi, I'm Ahava. Today, I'm joined by my incredibly brilliant friend, John Davey, to talk about digital marketing challenges and opportunities in healthcare. You've got questions, we've got answers. John, thank you so much for being here. And can you introduce yourself?
Absolutely. I'm John Davey. I am the Vice President of Marketing Technology at Mount Sinai Health System, a large academic medical center in New York City.
Recently, you talked about the two P's of healthcare marketing, pilot and patience. Tell me more about that.
It's probably true to anyone trying to convince anyone in any business to do something new. Um, People are afraid of change, understandably. That's just human nature. And especially now when there's all these extra pressures, uh, they're extra worried about doing things differently. But we all know because the world is changing, because healthcare is changing, we have to change what we do as marketers to succeed. And two ways to ease people into that. The first piece of it is a pilot. You don't have to, boil the ocean. You can explain to leadership, to stakeholders, let's try something small. You tell me what the business need is. I'll tell you, here's a pilot to try this new method to achieve that business need. And we're going to collectively define what success will look like for that pilot, what the timeline will be, what the resources required will be, what roles and responsibilities. And then we launch that small, very targetable pilot and see if it works or not. The patience piece of it is human nature. You can even say that, you can pilot, you can explain that, and people still might be resistant. And again, you can't get upset with people. You have to understand that they have their own challenges. What you're bringing to them is one piece of their day. They have a billion other things, especially for healthcare. So you have to be patient. And if you try once and you try to make that case and they don't buy into it that first time, that doesn't mean you should give up, because oftentimes people need to sit with something for a while. And also sometimes their business needs, their business problems get worse over time, and then they're more willing to try something new.
So I want to ask you a question because you have a really excellent reputation in our industry of getting things done and also keeping everyone calm. Where did you learn to do that? Because sometimes in order to get things done, you kind of have to, you know, push people. And I'm assuming you do push people, but you do it in a way that creates consensus. Where did that come from? How do you think about doing that? Is it just a natural thing you would developed over time?
I think it's always reversing it. It's putting yourself in the stakeholder or the leader's shoes, understanding what do they need? What are they worried about? Okay, and then how can I help them get what they need? If you frame it that way, you can say you can slide in there what they're going to need to do, but it's to make their lives easier, to make their day easier, to make whatever their boss is asking of them, it's easier for them to give their boss that. If you frame it that way, and then you're really clear about, again, we're doing this to help you, and to do that, here's what needs to be done, and to be as clear as possible. And I really think, like, if you put together a process that includes uh, put everything in writing, get everyone to sign off in writing, and then go. And of course, things won't go perfectly, but when they don't go perfectly, and if that timeline, if the roles and responsibilities have to change, then you have to then get people to in writing sign off on what changes need to be made, and then over time you get people's trust. That's the other thing. So help them meet their own needs. In doing that, you instantly earn trust, and then from that point forward, you can say, remember what we did last time for this other issue. Trust me, I can help you meet this new issue.
Right.
It's that.
How often, honestly, do you think you scale a pilot that was successful?
That's a great question. That is so key. I think it's going to be the opposite of what you think. I think the majority of the times pilots work. And so there's that to begin with. And so you'd say, oh, so it must be the majority of the time you scale it. That's not always true. It's because even if you have a proven concept that a pilot completely proves, even if it's provably ROI positive, it's the other thing you have to be patient about, because again, resources are limited in healthcare. And even if you say to the CFO, hey, you gave us $1, I made you $5 on this, give me $100, I'll make you $500. Sometimes there are other more pressing needs for the health system's resources that they can't devote to that pilot or that concept right now. But it doesn't mean that they won't in 6 months or next year.
Gotcha. So it's continuing that relationship and establishing that trust that just moves forward, even if you don't say yes to the pilot immediately.
Right. It's also not, getting frustrated to say, hey, we had this pilot and I proved it worked. And like, it doesn't help you to get mad about that.
Yeah.
It doesn't get
Yeah.
you any closer to getting them
No.
eventually to come around to funding it in a larger way.
Yeah.
Again, it gets back to putting yourself in their shoes. They have other things they're thinking about that moment.
When I need to have a difficult conversation, what I try to do is sit down and think, what do I want to happen? And And not do I want them to hear me? Do I want them to listen to me? Like obviously maybe in my personal life, but in my professional conversations, it's more what do I want to happen? What needs to happen? And then going in with this really open mind of like, they're going to tell me something that I haven't thought of myself, and I need to be open to that. So I think that that's also, thinking about the relationship and not always coming to the bottom line before you go into like a spirit of curiosity, I guess
that is key, because it is such a danger for any of us who have done something for a long time, and we know what we need to do to succeed.
Yeah.
And you just you want to tell people, no, you're wrong. Just trust me. This is what we have to do. That's not always productive.
Yeah. Well, I will tell you, one of the things I love about being in digital marketing is that I think it changes so fast that there is a certain amount of humility that comes with it. And I think it's one of the reasons that I love thinking about these things and constantly learning new things about them, is that right now we're in a moment of, we don't really know. The AI overviews, the top of the funnel, all that stuff. It's not humiliating to say to a stakeholder, we don't know, especially when you're dealing with scientists. It's the data is still playing out. We're still doing the research. We're still trying to figure it out. What, in your opinion, right now in the middle of 2025, is the thing in healthcare marketing that you're thinking about a lot, whether it's a good thing or something that's really challenging you?
Yeah, I think that it's the biggest opportunities are also the scariest things, and vice versa. They're two sides of the same coin. The ground has shifted under our feet radically. It started with COVID and everything that came after that, and then it's really accelerated, and AI has accelerated a lot of that. It's also changed how the human brain has worked. And so the human brain, as we all know, it wasn't always great at focusing, and it got even worse. And the attention spans have changed. The expectations have changed. How we capture that, all those brains and their attention has changed. How those people want to interact with the services we provide, the products we sell, has changed. And
can I say one other thing that's really changed? The truth.
The truth, right? Exactly.
We can agree.
Exactly. And so a couple things about that. We can't pretend that didn't happen. It did. And we have to take advantage of that. Okay, so now that we know people are thinking about our product differently, are thinking about how they want to interact with our product and our services differently, we have to lean into that. It also gives us new opportunities. And I think that's why I've also said this connects it all to what you were saying about being curious. Everyone has opinions that they're worth as much, the old analogy, which I won't complete. Follow the data, and the data is changing. And so, especially as you just pointed out, like a lot of these stakeholders, a lot of these leaders are evidence-based scientists, research physicians. They can't argue with data. Sometimes they try, but it doesn't have to be my opinion versus your opinion. I'm going to show you some data that show this is the way to go. And that's why, again, piloting helps with that. And then it's, again, being patient. When you show them the data, they won't automatically at that moment say yes, but you can make that argument over time with data. So I think the biggest things that make me nervous is that the world has changed. How people want to be interacted with has changed, but that shouldn't paralyze you. That should say, okay, let's lean into that.
Right.
What are the best ways to meet the needs of this new consumer and meet them where they are now? And obviously, AI gives you both the challenges, because it's changing how people search, and it's changing how we can surface our services and our products to those people. But also, if you lean into it, it gives you new opportunities. That's what. And to your point, don't ever think that what you know today, I'm an expert today, it means you're going to be an expert tomorrow. No, continue to be curious and open.
A lot of people are coming to us now because things are changing, and the headwinds, one day it's one way and one day it's another way. And they've been asking about their enterprise content strategy, as well as how they balance investments across digital, social, and traditional media. Mm-hmm. Now, a lot of this seems to be centering around paid search. And is paid search still as valuable as it was back in the day when, top of the funnel was still on the page, you still had to link to it and you still could go to it. And I just wrote an email newsletter about this. And I talked about, if you're going to rethink your enterprise content strategy when the top of the funnel is gone, that means you have to think about how your budget looks. How, are you stealing from Peter to pay Paul? And is that really where the ROI is now? So can you talk about, you have so much experience, you have been at a couple of AMCs, what the importance of a diversified channel mix and patient acquisition is, and how you balance it all at Mount Sinai?
Yeah, I think the first thing, I was just in meetings this week where people are asking, hey, are websites still important? Do you still need a website? Do you still need web content?
For those of you who don't want to watch further, the answer is yes. You 1,000% still %.
Right. If they're bored up to this point before you drop off, it is a website is still
Spoiler alert.
important. And it's for the same reason. All these new tools are learning based on content. So you do need content. Now you need to rethink in some ways how you structure that content, what that content is, how it's
How you
presented,
create
et
it.
cetera. And there's lots of learnings already about you can't have generic content anymore. There are better sources that these tools are going to be mining to come up with the AI generated response. But it is the specifics that you can talk about your own services and products and how they're different. That still really is important. And if you don't, if you stick your head in the sand and you don't think about this or make any changes at all, and you just keep your content as is, you're going to be left behind. And then the curve to catch up is going to get steeper and steeper. So it actually is all the more important to have a content strategy that you're really looking at modifying content to meet these new needs. And it really is drastically different from what we've been doing for the last number of years. It's a scary thing for people, but again, the longer you wait, the harder, the scarier it's going to get. So I think that's a way to begin to do this. And where do you begin? Start someplace. Start prioritizing what's the most important part of your content. Start tackling that. Start setting measurable goals, smart goals against that, and see how this works. And the thing about data and all this is see what works, see what doesn't. It's okay if some of these changes don't work. That's a learning, and even that is valuable.
Right. I'd love to give one very small example of where I think that this is really critical. And that's, we used to ask questions about, should we have separate pages for patients and separate pages for physicians? And one of the things that I've been talking to people about is that now the queries are going to come and the scraping is going to happen from your website itself. So you better include all the information a physician and a patient need to know. And it doesn't matter necessarily where it's living on your website, but it better be structured so that it's scraped by the person who needs the answer. Sure. And I think that that's just a very simple example of how we used to hear people say, well, physicians don't come here anyway. So like, what do we care? They're going to be inside of Doximity. And it's like, well, yeah, the LLMs might be scraping Doximity also, but you want to make sure that that data is coming from a certain specific place so that if somebody follows that cited link back, they'll get to where they need to go. So it's an exciting time. I think the one thing that I always tell people is if you follow best practices, you're okay. You're going to be okay. One last question for you. Can you tell me a story about building consensus or collaboration between marketing, clinical, and operational teams?
I think that is key. And it's probably touches on a lot of things we've already talked about, but the way to do it, I'll start again, intentionally being repetitious by saying, understand how each of those different teams, what their needs are. Understand that what you're going to them for is not necessarily their top priority. Try to reverse engineer it to say, what's one of their business needs that I can help meet, that I or my team can help meet. And really equally importantly is the trust building portion of it, that especially nowadays when we're connecting all these different data streams and there's a lot of sensitive data. We have a lot of powerful tools that we can use to build business for them to meet these business needs, but there's a lot of sensitivity around that. And
that's a good point.
Have to be always mindful to protect, most especially if it's anything involving our patient data, that we protect that and that no one has to doubt that we're not going to be completely sensitive and compliant and that we're not going to get ahead of them in anything we're doing, and that we're not going to take a step forward without their approval. And we'll come up, same thing that we talked about before, come up with this process where everyone gets to weigh in on what the process is, what everyone's roles and responsibilities are, and then sign off on that and then launch that. Once you do that, everyone has a better understanding of what this is and what it isn't, and then you build their trust, and that trust building is so key. And you really can't slip up because you got to keep their trust too.
Yeah. It sounds like it's foundationally just about respect for the patients, respect for the stakeholders, respect for your team, respect for how everyone's involved, and respect for the process of what we're really trying to do here, which is match the right patient to the right provider at the right time. And I think that's the part, right?
Yeah, that's the other way when you boil this all down to its absolute essence, that is kind of the real North Star. The good thing about healthcare is we are selling a product. We're not selling sneakers or soda. We're selling, in our case, world-class healthcare. And we know there are people desperately in need of that. And our job is to help connect those two things, connect people desperately in need for themselves or their loved ones to health and wellness, and a return to health and wellness if they're ill. And it's an incredibly stressful time, and we have tools that help people connect themselves to that care.
Yes.
And that's we always say, my boss David Feinberg always says, we indirectly save lives, and that's really inspiring. We should never forget that. No matter how stressed out we become during all this change, that's the business we're in.
That's right. And I say that all the time. I always say, I go to sleep every night and I think somewhere around the world, somebody read something that one of Aha Media Group employees wrote, and it made them feel like they could make a better choice about their healthcare. And I agree with that 100%. It's keeping the mission core, but I think it's also talking about that sort of hammock of respect that we need to bring to every interaction. Right. John, I learned so much from this conversation. Thank you so much. Where can people find you?
They can find me on LinkedIn. Ahava and I spend a lot of time at the same conferences, and you can email me directly at john.davey@mountsinai.org. And happy to talk more about this with anybody. It's so we're all in it. If you think you're an expert one day, you're not the next day, so we can all learn from each other.
Well, thank you so much for being here. Thank you for joining me. If you have a question or a hot take, please email me at ahava.leaptag@ahamediagroup.com or comment below. We'll see you next time. Thank you.